All right, great. I think we can start now. I believe everybody can see my screen. So today we'll be talking about cervical cancer, and my name is Dr. Akinkunmi Ilori, and I'm the Group Head of Medical Operations here at Bastion HMO. And as we all know, it's Cervical Cancer Awareness Month, January of every year, and we want to use this opportunity, of course, to educate the public about cervical cancer. This is not just for the women in the house, also goes out to fathers, husbands, people who have women in their lives who they can encourage, who they can educate, who they can also help to raise awareness for. So it's a very interesting topic, and it's something that everybody should know, not just the women in the house. Every single person should know about cervical cancer because it's a very critical illness, especially in this part of the world, and it's important that we have the right information to be able to help family, friends, and loved ones. So I'll just go ahead and start. So this is just a look at the outline that we'll be using, basically. Yes, so first of all, just to give a brief description of what exactly the service is for those who are not familiar with what it is. So basically, the cervix is a part of the female genital system, and it's what is located at the lower narrow end of the uterus, which is called the womb. So it's what connects the uterus to the vagina, which is the birth canal. So it's like a narrow cylindrical opening that lies between the uterus and the vagina, which is the birth canal. And of course, through that canal, which is the cervix, fluids like menstrual blood uh, is able to pass from the uterus into the vagina. So you can see the importance of the cervix. And of course, you say to yourself, the cervix is narrow, it's cylindrical, but it's interesting to know that during childbirth, the cervix actually widens so that a baby can be born. I'm sure husbands and fathers in the house who have been with their wife during childbirth, which the doctor or nurse says that the cervix is 3 centimeter dilated, it's 5 centimeter dilated, it's 8 centimeter dilated, things like that. That's the widening of the cervix so that the baby can actually um, be born. So even though it's a narrow canal in the normal state, it widens over time. It widens when the woman is contracting, the pregnant woman is contracting, is about to give birth to that lovely baby boy or girl. Yeah, so what you can see here as well is the structure of the cervix. And of course, you can see where it's located right there, as I said, between the uterus and the birth canal, which is the vagina. Of course, you can also see the location of other very pertinent parts of the female genitalia, the fallopian tube and the ovary as well. So this is just to give you an idea of what the cervix looks like when you have cervical cancer, especially. So you can see exactly where it's appears. This is the longitudinal view, and of course the transverse view where you can see those cells that have become, disorganized and disorientated there, and that's how it looks. So we'll go into more detail about this as we progress in the slide, but this is just to give an idea of what it looks like when the cervix has been infiltrated by cancerous cells. Yeah, so what exactly is cervical cancer? Cervical cancer actually is um, just a disorder that starts in the cells of the cervix, and of course, over time, it develops. You know, so cancer does not just develop overnight. It's something that happens gradually over time. So before cancer can actually appear in the cervix, there has to have been some sort of abnormality in the cells of the cervix. These cells go through changes that are known as dysplasia. It's abnormal. This is when abnormal cells begin to appear in that cervical tissue. It happens over time. It's not something that just happens overnight. So it's important to know that someone who's said to have cervical cancer must have been having such changes in the uterus probably over a few years before eventually gets to the stage of being cervical cancer. And of course, if it's not curbed on time, if it's not destroyed or removed, the abnormal cells may actually become cancer cells, and then they start to grow and develop. And in cervical cancer, of course, as you will see later on in the presentation, it's not just disease that just stays within the cervix. If it's not controlled on time, it may actually go to other parts of the female-genital region, and of course, it can also spread to other parts of the body. That's what you call metastasis in medical terms, where the cervical cancer becomes so advanced that it goes to other places, can go to the ovaries, it can go to the kidney, it can go to the liver, it can go to the lungs, it can go to different parts of the body through what is called metastasis. So that's why it's very important that changes in cervical tissue and diagnosis of cervical cancer is taken as seriously as possible. And of course, we also see later in the presentation the importance of what is called the HPV vaccine. So you can see here that HPV infection, which is the human papilloma infection, is the number one cause of cervical cancer. And it's an infection, it's a virus, and that is usually spread through sexual contact. And of course, as I said, cervical cancer usually doesn't cause symptoms until it begins to spread. That's why you can call it a very dangerous disease. It doesn't cause symptoms until it begins to spread. So a woman can have cervical cancer, and yet you may not have any symptoms. You may not just be going about your daily work, without knowing that there is something happening in your body. So it's very, very important, the prevention and the screening, as we will see. Yes, so as I mentioned, what causes cervical cancer? It's caused by HPV, a sexually transmitted infection, and of course, it's usually spread through sexual contact, which can be anal sex, oral sex, or of course, vaginal sex. And it's important to note here that most people will actually get human papillomavirus at some point in their lives, but not everybody will have symptoms in their body. So you can have HPV vaccine and just in a few days or a few weeks, your immunity just flushes it out of your body and you don't have any symptoms at all. But in certain people, small percentage of people, who do not have a high immunity or who have other factors, cohabitating in their body, some certain other illnesses in their body, their immunity may not be strong enough to be able to flush out that infection or that virus from their body. So it would go on to cause other things. Of course, it's noteworthy here to mention that HPV doesn't just cause cervical cancer. There are also other cancers that it can cause, but cervical cancer is one of the major ones that it actually causes. And then, of course, if your body doesn't fight the infection, like I said, it can cause cells of the cervix to change to cancerous cells. So what exactly are the risk factors for cervical cancer? What are the risk factors? And we can break down these risk factors to different types. It can be general risk factors, genetic risk factors, factors related to lifestyle, and other conditions as well. I'll just run through this, of course. General risk, of course, involve multiple pregnancies. It's been seen that women who have had at least 3 full-term pregnancies are more likely to have cervical cancer. This has been associated with cervical cancer. Also, women who have had early pregnancy. When you talk about early pregnancy, you talk about women who have had their first full-term pregnancy before the age of 17. They are twice as likely to have cervical cancer. So it's important to note these things, especially in this part of the world, or, in the African terrain where we have a lot of early pregnancies and have a lot of women who've given birth to 4, 5, 6 children. It's important to understand these risk factors when we are educating people as well. In terms of genetics, the genetic risk factors, family history is very, very important. Just as it's important in other illnesses and other diseases as well. Women with a sister or mother who have had cervical cancer are 2 or 3 times more likely to develop cervical cancer. So you can see the importance of family history, which is why it's very important to get close to our families, to know what's been going on within our households. So I can know that, okay, if I've had a mother, a sister, even a grandmother. The risk may not be as high if you had a grandmother and the mother doesn't have it, but there's still a risk. But it's more pronounced when it's a sister or a mother who has had cervical cancer in the past or still has it. The tendency, that you would have it, another sister or daughter is 2 or 3 times as likely as the general population. So it's important that we know our family history in terms of things like cervical cancer, and not just for cervical cancer, even having a family member who has had another source of cancer, breast cancer, ovarian cancer as well, also increases the risk of developing cervical cancer. Talking about sexual history, now going to lifestyles, um, it's been seen that sexual intercourse before the age of 18, having sex with multiple partners and sex with someone who has had multiple partners are also considered sexual behaviors that are risk factors for cervical cancer. So you can see that sexual history has a lot to do, plays a big role in terms of having cervical cancer. Also, in terms of smoking, a woman who smokes, increase the risk of cervical cancer, in fact, doubles the risk of cervical cancer. You see that smoking always comes with a lot of hazards, in terms of diseases and illnesses. I'm sure you've heard of other diseases where smoking is a predisposing factor as well. So it's very important to do without it or keep it to the barest minimum as much as possible. In terms of oral contraceptive pills, it's also been seen that oral contraceptive pills also play a risk when it comes to having cervical cancer, and this mainly is due to the fact that some of the hormones released in these contraceptive pills, have an effect on the lining of the cervix, that causes it to be vulnerable to the HPV vaccine. So it's important. We know that oral contraceptive pills are hormonal. They have estrogen and progesterone and things like that. So they go to these organs, they go to the lining of these organs, and they weaken it so that they are more susceptible or more vulnerable to cervical cancer. So it's important that you know this. But if you take the pills for a while and then you stop it, it's very likely that the risk of you getting cervical cancer will return to normal within a few years after the pills are stopped. So that's also something that's very important to note as well. So other conditions, as I said, weakened immune system. I said before that having the HPV vaccine is very, very likely. Most times, it's 9 times out of 10, it will just get flushed out of the body after a few days or a few weeks. But in some people who do not have a strong immune system, it can, stay in the body and then lead to other illnesses, of which cervical cancer is a part of that. So most people with healthy immune systems, if the virus clears itself within 12 to 18 months at the most. At the most, sometimes it takes just weeks to clear itself from the body. However, people with HIV, as I said, syphilis, chlamydia, other health conditions, or people who take medications to fight off infection will definitely have a higher risk of developing cervical cancer because their body will not be able to, really flush out the HPV virus from the body. Now, there's a drug called diethylstilbestrol as well that was very common, back in the mid 1900s, and so usually given to women to prevent miscarriage. I think that drug was first introduced in the United States, and what it does is to prevent miscarriage, especially for women who have been having miscarriages in other pregnancies, to stop them from miscarriaging more. But it was seen through research that most women who were given this medication, you know, ended up developing cervical cancer. Their risks were more, and quite a good number of them came down with cervical cancer at the end of the day. So that's also something. Although the use of this drug to a large degree has been discontinued, so we really do not have much of this anymore. It's been discontinued when that was discovered. So there are other medications, other drugs that can be used to prevent miscarriage that are safer than diethylstilbestrol. Yeah. So talking about clinical signs and symptoms. So cervical cancer usually doesn't have symptoms at the start. So it's as the disease progresses, stays in the body for a while. That's when it now becomes start having symptoms after the cancer has spread. That's when symptoms usually, begin. And of course, in the next slide, we'll take a look at some of these symptoms, which come both at the early stage and also at the late stage. It takes about 3 to 7 years for abnormal cell changes to become cancer. So you can see why screening is actually very important. And we'll see much later in the slide how important it is. You can actually have abnormal cell changes in your cervix for 3 to 7 years before it actually becomes cancer. So you have enough time to actually screen for precancerous cells and do what is necessary to ensure that to a large degree it doesn't become cancer and of course spread through other parts of the body. So what are the symptoms of cervical cancer? So we have early symptoms and of course we have advanced stage symptoms as well. So for early stage symptoms, basically a lot of bleeding occurs, vaginal bleeding after sexual intercourse, vaginal bleeding after menopause, is also a very major symptom. And of course, vaginal bleeding between periods, after a woman has a period, I still see that you still continue bleeding even between periods when you're not supposed to be bleeding. And usually they're even heavier and longer than normal. Imagine having bleeding that is even heavier than your normal period. That is a warning sign to say that there might be something fishy. You need to get yourself checked out by your gynecologist. Also, vaginal discharge that is watery and has a very, very foul odor, or a vaginal discharge that actually contains blood. Sometimes we have discharge that contains blood. It doesn't mean that it's cervical cancer, but it may be a cause for alarm just to see your doctor to help with the diagnosis to see if it's cervical cancer or something less severe. And of course, pelvic pain or pain during sex. So it's what's called dyspareunia, in medical terms, when you're having pain during sexual intercourse or just when you're doing your day-to-day activities and you're starting to you notice that you're having pelvic pain, getting tired easily and all that. It might point to early stage symptoms of cervical cancer. In terms of the advanced signs and symptoms as well, you have things like difficulty or painful bowel movements from the rectum. Remember, I said that um, cancer, cervical cancer especially, can go to other parts of the body. So when you talk about other parts of the body, you talk about the closest parts, especially the rectum, the vagina, the ovaries, before it now even starts going to other places like the bladder and the liver and all that. So when you talk about difficult or painful bowel movements, it's possible that it has affected the rectum or the lower gastrointestinal tract, So you see that it causes bleeding, and then you have pain when you go to the toilet. You see that it's very difficult for you to pass stool, and you feel a lot of pain. So also in terms of urination, there could be painful urination or even blood in the urine, meaning that it's very possible that the cancer cells, has found its way to the urethra, the ureter, or the bladder, whatever the case may be. And of course, a dull backache, because we also all know that as well, that cancer can affect the bones. It can spread to the bones as well. So you can have bone pain, you can have muscular pain, and it usually always starts with the spine, the spine and pelvic area. That's where it starts from when you talk about bone pain, affecting the spine, affecting the vertebrae, affecting the pelvic bones. It's important that we are able to detect the symptoms on time and get the help that we need. That should be swelling of the legs. Apology for the typographical error. Swelling of the legs as well, when it starts affecting that part of the body. Pain in the abdomen, that's when it starts getting very, very severe. Trying to have pain in the abdomen, it's creeping up to the GIT, upper GIT, the stomach, the large intestine, the small intestine, and then of course a general feeling of fatigue as well. Feeling tired all the time. You that you were able to do so much work, run up the stairs, do all sorts of things and not get tired, go to the gym. All of a sudden, you just notice that that person, within just a few steps of walking, the person is already panting, feeling very tired, feeling very fatigued. So it's also a warning sign to um, cervical cancer as well. And even other sorts of cancers, when they become advanced, also show this type of symptoms. So most of these symptoms are actually general for even other forms of cancer when they spread to other parts of the body. Okay, so basically just a pictorial representation of the 10 major warning signs of cervical cancer, which most of which we've discussed already. It talked about the unusual vaginal discharge, which usually has a very foul odor and can also be watery. We talk about abnormal vaginal bleeding, which you can see there. Your menstrual cycle might be heavy and longer, discomfort while urinating or while defecating, loss of bladder control. Sometimes also something very important. Just see that you can't even control your bladder, urine just starts coming out on its own. Pain during intercourse, we've discussed that. Constant fatigue, chronic fatigue, pelvic pain, unexplained weight loss, something very important as well. Just see that you are losing weight even though you are eating well just as you used to, but you are not gaining weight, your clothes start getting, loose on you and all that. It can point to a more critical situation. Also, leg pain, if it affects the bones, there may also be pain in the leg, the bones of the leg as well can cause pain. Okay, so yeah, just to give an idea of what it looks like to sorry, I'm trying to mute this up. Okay. All right. So just to give an idea what a normal cervix looks like and what different stages of having cervical cancer also looks like. I talked about early stage symptoms and advanced stage symptoms. And there's something called staging in cervical cancer. It's not something that we're going to go into in this presentation. That's a much deeper level. But just to know that there are different ways in which cervical cancer is staged. I can see the early stage 1B, late stage 1B, and of course stage 2B when it has gone outside the cervix. So you can see what the normal cervix looks like, both the transverse view and the cutaway view there. So you can see how smooth it looks in the normal cervix, no degenerate cells, no abnormalities. And then moving on to the early stage where you can see that the cancer is starting to build up. Those lesions are starting to build up, they are growing, into the tissue of the cervix. And then going on to the late stage as well, you can see it's more pronounced now. It's almost taking up the whole circumference of the cervical tissue over there. And you can see it's almost blocking the opening. And then for the stage 2B, which is already gone outside the cervix, so it's moving down to the vagina. So it's pressing on the arteries and veins of the vagina, which of course causes the bleeding in the vagina. You can see it moving out to other areas. Some of the time it will move up even to the uterus or move to other places like the fallopian tube and the ovary. So it's very important that we know how cancer spreads in the cervix as well, to both within the female genitalia and also outside the genitalia. All right, so a very important part of the presentation, cervical cancer screening. It's important that we get screened. As we said, cervical cancer just doesn't start in one day. It's something that builds up over time, builds up mostly years. It builds up, starting with abnormality in the cells, and then it builds up to the cervical cancer. So this is just give us an idea of how to actually screen for those who are at risk of cervical cancer and those who are already having early stages of this. So it's going to look at what cervical cancer screening is. When exactly is a woman supposed to get screened for cervical cancer, and of course, what to expect during a cervical cancer screening. Of course, some of our listeners would have already done some form of cervical screening. So, what exactly is cervical cancer screening? This is just to check for signs of cervical cancer and pre-cancer before you have symptoms. So that's an important detail to note. Check for signs of cancer or pre-cancer before you even have any symptoms. If everybody says that they want to wait till they have symptoms before they go for checks, then we are not going to be able to save anybody from cervical cancer, because for you to have started having those symptoms we spoke about, if the disease has gone a fair way or a very critical way. So it helps for any diagnosis and treatment that can actually prevent cervical cancer. And of course, there are three major screening methods that are used for screening for cervical cancer. There's something called an HPV test. I've talked about the human papillomavirus, which is the HPV. So it's a test to actually check for high-risk strains of the human papillomavirus. So human papillomavirus has different strains or types, you know. So it's not every single human papillomavirus that causes cervical cancer. I think the ones that cause cervical cancer are the 16 and the 18. So we have different numbers, you know, of cervical of HPV, but it's just two major strains that cause cervical cancer. I believe that's the 16 and the 18, if I remember properly. So it's important to know that. So that test has to be done just to also check for that, being that human papillomavirus is the most common cause of cervical cancer. Another important test is what we call the pap test or the pap smear. I know a lot of people are familiar with this. So what the pap smear does essentially is to check for abnormal cells in your cervix that may become cancerous without treatment. So checking for the abnormal cells, you know, the early stages to see that, oh, the texture of the cells in the cervix is changing, the color is changing, it's not supposed to be like this, why is it rough? You need to check all those things, that what's going on. Something that should be smooth, are we getting rough? Why is the color changing? And all that. It's important that that test is done at certain points in a woman's lifetime. And we'll get into when it should be done as well. So yes, very important as well. When exactly should a woman get tested for cervical cancer? Can I just go anytime I want to see a doctor to say that I want to do cervical cancer? How often should I do it? It's a very important question. Do I go every year? Do I go every 6 months? Do I go every 5 years? When exactly should I go and test myself for cervical cancer? So it is recommended, you know, that from age 21 is when testing for cervical cancer should actually begin. You know, it's not advised to go earlier than 21. So basically, 21 years, that is the cutoff that has been recommended by the World Health Organization and also by the CDC, the Centers for Disease Control. So if you're in this age group, it is recommended getting your first pap test at age 21 and then followed by pap test every 3 years. So it's 21 and continue every 3 years. So it says that even if you are sexually active, you do not need a pap test before the age of 21. So we see young girls, 14, 15, 16, who are already sexually active, some even getting pregnant at that age, you know. But it's not recommended, even if you're sexually active, to have a pap test, because being seen that below that age, it is the cells of the cervix are not prone to having those changes, you know, through research that has been done on those cervical cells for people of younger age. So 21 is the cutoff mark to start. So what happens if you are above 21 to 29 and you still want to get tested for cervical cancer? So between the ages of 30 to 65, if you are between the ages of 30 to 65, it's recommended that you do the HPV test every 5 years or a pap test every 3 years as well. So there's something known as the HPV pap co-test, which is combination, of course, the HPV test and the pap test every 5 years, and that's what is recommended for that age group. So between 21 and 29, as I've said, what you really need is the pap test. The pap smear is what you really need. And then between 30 to 65, you're having the pap test every 3 years, the HPV test every 5 years, or the HPV pap co-test every 5 years as well. What if you're older than 65 years? If you're older than 65 years as well. So there is no written down rule, there's no set down rule for people older than 65 years. If you are in this age group, you actually need to speak to your gynecologist to learn why you still need screening at that age. Depends on your immunity. If you have other illnesses within you, even things like hypertension, diabetes, if you've done surgery before, if you've had some sort of cancer before in your lifetime, that has been treated, all those things play a major factor in terms of getting tested for cervical cancer if you are older than 65 years. Of course, if you have been screened regularly and had normal tests, even if you've done it in the past, you have been normal, you really do not need to do it again after you are 60, 65, but if you've had test results in the past that have been abnormal, or you really have not been screened regularly when you're in your 20s, 30s, or 40s, you actually may need to continue screening beyond 85. But of course, this is at the discretion of your gynecologist, to discuss your own situation at that point in time to determine if you need to get tested or not, or you need to go for further testing or not. So there are some exceptions to the rule, of course. Some people may need to take the PAP test or the HPV test a bit more frequently than 3 years or 5 years apart. One, people who are HIV positive. People who are HIV positive may need to do this test annually or every 2 years or even less than that. So if you have a weakened immune system, people who have tuberculosis, other diseases that have made their immune system very weak as well, need to take it a bit more, the test a bit more frequently. There's no set regularity. As I said, it's something that has to go with a discussion with your healthcare provider, but it needs to be done more frequently than every 3 years. Of course, as I talked about, diethylstilbestrol as well. If you're exposed to that, we don't see a lot of that right, especially in this part of the world. That mostly applies to people in the US and other parts of Europe. Or if you've had a recent abnormal cervical screening test or biopsy results, it's also an exception to the screening that, or if you have had cervical cancer, so if you have had cervical cancer in the past, and were treated for it, you may need to have more frequent testing than every 3 years or every 5 years. You may need to have it as frequent as 6 months or every year. So these are some exceptions to the normal screening guidelines that I showed you in my earlier slide. Of course, this should also always be done with the consultation of your gynecologist, not just going to the clinic yourself to demand for a test. And of course, what to expect during a cervical cancer screening test. It usually takes not more than a few minutes, and the cervical cancer screening tests are usually done during a pelvic examination. So it's a full-fledged pelvic examination where this test is done. I think I have a diagram in the next slide that will also throw more light on that. And of course, during the exam, you lie on your back on an exam table, you bend your knees, and you put your feet in support at the end of the table. So basically, there's a recommended way of which you have to, place yourself on the examining table to be able to get the best results. And of course, the healthcare providers use what is called a speculum. Some of them may be familiar with this, using a speculum, just to get more visuals, to be able to see the cervix and be able to get the samples that is necessary from the cervix. So all you use is a soft, narrow brush or tiny spatula is used to just collect a small sample of cells from your cervix. And this is just what it looks like, pictorially. That's the speculum that goes through the birth canal, just to have a better visual aid to the cervix, to be able to then take your sample. Yes, so just continuation of what to expect. When you take when the cervical test is done, the sample is taken to a lab, and then they check for any abnormalities to see if it's infected with any types of HPV, and also check for abnormal tests. So the HPV test is just to check for the virus. If you can see any signs of the virus inside the cells, and then the same sample will also be used to check for abnormal cells, which is the pap smear. So that's what I talked about. When both an HPV test and a pap test are done on the same sample, this is what is called an HPV pap co-test. Of course, a pelvic exam may include more than taking samples. The gynecologist may also use that time to also check if there are any abnormalities within the female genital tract, looking at the shape, position, and the size of the uterus, the ovaries, check if there are any lumps, any cysts, which will also help him to make a more informed decision about your overall diagnosis and he will also be able to come up with a very excellent treatment plan as well. Okay, so we've talked about screening. It's also important that we talk about the main diagnosis of cervical cancer. Of course, we know that screening majorly is for pre-cancer, but it can be used for cancer as well, but pre-cancer, when those abnormalities are happening in the cervix, just to know that am I having any early signs of or early symptoms or any signs that can lead to a cervical cancer. But you also need to make a diagnosis. If someone has actually had cancer, how can you, categorically make that diagnosis to say that, okay, this person has cervical cancer? And there are just a few ways that this can be done. There's something called a colposcopy, which we'll go into more detail in the next couple of slides. And of course, what is also called a biopsy, which can be four different kinds of biopsy. We won't dwell too much on this, but we'll just look at them a little bit in detail, one after the other. So you can see the colposcopy as well. So of course, you can also see the speculum is also used here in the colposcopy, and there's something called the colposcope, which is like a microscope that you look into to be able to see what's going on in the cervix and see the abnormalities, to be able to view the cervix. So the solution is used applied to the cervix to help show the abnormal areas. So basically, as I said, the colposcope is just a magnifying lens just to help the practitioner to have a better view of the cervix to help him ensure that he makes a very reliable diagnosis. Usually, a colposcopy usually includes a biopsy, which I'm also going to go into more detail. So basically, what's a biopsy? A biopsy is a procedure in which a sample of tissue is removed from the cervix so that a pathologist can view it under a microscope. And of course, there are different kinds of biopsies, which we will see very, very shortly. We have what's called a punch biopsy, which is one of the most common biopsies. It's just where a sharp, hollow instrument is used to just take a piece of tissue and able to get that tissue and do a test on it. There's something called an endocervical curettage. It's a procedure to collect cells or tissue from the cervical canal using a spoon-shaped instrument as well, just to be able to see, have enough tissue to help with the diagnosis. There's something called a leap, which is also a more advanced procedure where an electrical current is passed through the cervix to be able to remove that tissue. It's also one of the ways to diagnose cervical cancer. And of course, we have the cone biopsy as well, which is also used to remove a larger piece of tissue from the cervix and cervical cancer. So there are different ways of identifying these cells. Of course, you know that there are different parts of the cervix, of the uterus. So depending on where exactly the cancer is, depending on where exactly the cells are, the abnormal cells, that will determine what kind of biopsy that will be used, at the end of the day to actually extract those cells, which is how we have different kinds of biopsy. If the abnormal cells are in a particular part of the cervix, it may not be easy to get it to a cone biopsy. You might need to use a punch biopsy and vice versa. So depending on where exactly the cells are, will go a long way in determining which of these biopsies that will be used. So of course, this is just to give you an idea what it looks like. The topmost one to the right is the biopsy where you just get a bit of the tissue sample. And you can see the others, the curettage where you're scraping. You can see the spoon-like curette there to be able to get the tissue. This is like a blade just to get some tissue, and of course the leaf as I said, something called an surgical loop that is used to extract the tissue as much as possible. So going to the treatments now, we have to move a bit fast as we're running out of time. I still have to take questions. So when we talk about treatment of cervical cancer is often treatable. So it's not a death sentence. It's not something that you have and you feel, oh no, I'm done for life. No, it's not a rare. It's actually often treatable depending on on the severity and depending on the person's immunity, severity, when it started. Those are all the things I put into cognition. And of course, the treatment you have will depend on, as I said, it has spread so much where the cancer is. So, what are the kinds of surgery that we have for cervical cancer? Hysterectomy and other surgery. We won't go too deep into this just to have an idea of what surgeries are. So, what you call a hysterectomy, a total hysterectomy, if the cancer has invaded the uterus and invaded the cervix, it has invaded it so much that it cannot be, just removed by itself. You may need to remove the uterus and the cervix just so that it doesn't spread to other parts of the body and just so that you can save the woman's life. So you can see what it entails. The dotted lines on the screen is what shows the entirety of the uterus and also the cervix, and they would need to actually excise those parts just so that it doesn't spread more than that. So it can go through the vagina or through the abdomen. If it's going through the vagina, if the procedure is going to be through the vagina, it's called the total vaginal hysterectomy. And it's going to be through the abdomen, it's called the total abdominal hysterectomy. I don't want to go into more detail. So there's also something called the radical hysterectomy, where you might need to also take a part of the vagina and also even the fallopian tube and the ovary. So if the cancer has invaded these parts, you may need to do that. And we usually do, gynecologists usually do this when most times the woman has had all her children, people who have passed the age of childbearing age, essentially. So they usually take this route because once the uterus is gone, of course, you're not able to give birth to babies anymore. So usually women who have completed their families and are down with cancer, usually these routes of hysterectomy come in just to ensure that it doesn't spread to other body parts and to save the life of the woman. There are also other procedures called trachelectomy, which just involves removal of the cervix and nearby tissue and probably just a small part of the vagina. So it's less invasive than hysterectomies. It's just a small part of the cervix and the upper vagina that is that is used as you said as it's said in the lower part of this slide. If you have this surgery, you may still be able to become pregnant because they are not taking out the uterus, they are only taking out the cervix and the upper vagina. Okay, so essentially, I think we spoke about this to bilateral salpingo-oophorectomy. So we're talking about you may or may not remove both fallopian tubes and ovaries. When you hear salpingo means fallopian tube, and oophorectomy, means the or ufo means the egg or the ovary. So rectomy means cutting off in medical jargons, I would say. So it just depends on if what route the gynecologist wants to take. If it's going to cut both parts or just one part. And this is the most radical of the treatments. This is when the cancer has actually invaded the rectum, the anus, the bladder. Is something that is called total pelvic exenteration is done, where the surgeon needs to remove the lower colon, the rectum, and bladder and other lymph nodes, and then they have to put artificial openings called stoma so that the person can still be able to make urine and make stool. It's a very complex surgery and it's very, very radical. It's like a last resort kind of thing when the cancer has spread so much and they just need to take it all out or else it will spread to other upper parts of the body and the woman may lose her life. So it's a last resort thing. It's not very common, but it's a last resort thing that surgeons do sometimes. And of course, apart from surgery, another means of treatment is radiation. So usually after after surgery, sometimes they still need to use radiation to be able to ensure that the cancer cells do not come back, to kill the cancer cells completely. So it can be an external radiation or internal radiation. External radiation is just, essentially just using a high beam of radiation from the outside, to kill the cancer cells or to get rid of the cancer cells, while the internal radiation is there's an applicator that is filled with radiation therapy that is put into the body for a few minutes, very close to where it's supposed to, where the cancer cells are, and it's able to disrupt the mechanisms of the cancerous cells. Chemotherapy as well, you may be familiar with this. This just involves using strong medicines to kill cancer cells. So most times chemotherapy and radiotherapy go together, usually after surgery, just to ensure that the chances of the cancer coming back is very low. So chemotherapy goes along or in cases where the cancer is not that pronounced, it's just still within the cervix. Sometimes only chemotherapy can be used, and then we continue to do testing to ensure that it's not coming back in any way, it's not growing in any way. Now let's go quickly to prevention as we begin to round up. Can cervical cancer be prevented? Of course, it can be prevented. But there are some things you might need to do to help prevent cervical cancer. I talked about a bit of them. You need to receive regular gynecological exams, and of course, getting pap tests as well are very, very important. There's something called the HPV vaccine. We talked about HPV being the major cause of cervical cancer. So, of course, it's important that we get the HPV vaccine. We'll go through the next slide on eligibility for HPV vaccine and how you should take it. Using condoms or other barrier methods when you have sex. We talked about multiple sexual partners being a major risk factor, just because HPV is sexually transmitted. Human papillomavirus is sexually transmitted. So, of course, the more sexual partners that a woman has, the more the possibility of meeting someone who already has it, because HPV can actually infect both men and women. It's not just for women. It's just that in women it can cause cervical cancer. Limiting sexual partners, of course, stopping smoking and using tobacco products. So for the human papilloma virus vaccination, so basically it's just the administration of a HPV vaccine, which contains virus-like particles to help the immune system develop immunity, just like every other vaccine. The vaccines we give children, and all that, babies, it just helps to prevent that illness. And of course, it can be given to anyone between the age of 9 and 45, and depending on the age, it can be given in 2 or 3 doses. So HPV vaccine can prevent the risk of not just cervical cancer, but other kinds of cancer as well, like anal, vaginal, penile, vulva, and of course, other cancers involving the head and neck. So in terms of age, it is recommended, the recommended age for getting the HPV vaccine is actually between the age of 11 and 12. That is like the ideal 11 and 12 boys. Young girls, girls as young as 9 can also actually get the HPV vaccine. That's why they give the range of 9 to 14 now, but ideally 11 to 12 is when you should start, but you can get it as early as 9. So 2 doses, 6 months apart. So if you get the first dose today, by June or July, you should get the next dose if you are 9 to 14. And for people who didn't get it at that age, between 15 and 45 years, you can also still get the human papilloma vaccine, and people who are also immunocompromised at any age. So if you are taking it above 15 years of age, and if you are immunocompromised, that is, if you have other things like HIV, like tuberculosis, it's important that you take 3-dose schedule. So either between 0, 1 and 6 months, or 2, 6, or 0, 2 and 6. So there are different kinds of HPV vaccine, bivalent, quadrivalent, monovalent. So depending on the kind that you are taking will determine when exactly you're going to take it. But it should be in a 3-dose schedule for those who are 15 to 45. So finally, just talking about coping and support. As I said, it's a disease we should be taking very, very seriously. But as I also said, it's something that is treatable. It's something that needs the support of family, friends, loved ones. So for coping and support, it's important that we, of course, learn enough about cervical cancer, just as we're doing in this webinar, to be able to make informed decisions about your care. Feel free to always ask questions from your doctors, from your healthcare team. If possible, get a friend or a family member to go to appointments with you, take notes, search for information, go online, do your own research as well. Find someone to talk to. Things like this can also cause, even depression, in some people. So it's very, very important that you involve loved ones and close members of your family to be able to help you through these difficult times. And of course, let people help. Some people may want to seclude themselves. Feel that I don't want anybody to know what I'm going through. I don't want to disturb anybody. It's important that we let people help as much as we can. Here at Bastion HMO, we have plans, that cover things like cervical cancer. We have plans that cover these things. So it's important that we are also here to help as much as possible. Our patients are enrollees so that they can get the best care possible and the best support possible. Always know that friends and family are always most useful to you at this point in time. So I'll just use that in closing this webinar. So thank you very much. I think we can take a few questions and comments now.
Thank you so much, Dr. Akinkunmi. That was a very enlightening session. I'm sure many people on this call can agree with me. So I'm going to be reading some questions from the comment section or the chat. Please, if you have any questions, please just drop them for us in the chat. We're going to read it out. If you want to ask it yourself, just raise your hand and your mic will be muted. So the first question here is, good day and thank you for this webinar. So my question is about HPV. Since it's sexually transmitted, what about the men that introduce it to women? Are there vaccines for men or there's no test for them?
Yes, thank you. That's a very interesting question. So the HPV vaccine, yes, can be taken by both men and women. So it's not just limited to women. As I said, anybody can get human papilloma virus. It's not just for just that in women it causes cervical cancer. Which of course men do not have cervixes, so you can't cause cervical cancer in men. But both genders can get HPV. So the vaccine is not just for women, it's also for men. It's just that they emphasize it more on women because of the severity of having cervical cancer. That's why they talk more about women when you talk about HPV vaccine, but both genders can actually take it.
Okay, thank you so much. The person also asked if there's a vaccine for men, or is the vaccine just for women?
Yeah, I think that's what I just answered. It's the
Okay,
same vaccine can be taken by both men and women.
okay. And then someone asked a follow-up question, if there are tests, if men also run the tests like we do, females do.
Yes. So the HPV test can be done in both men and women. The pap smear is a different thing. Pap smear means looking at the cervix to detect abnormal tissue. But as I said, men do not have cervixes. But for the HPV test, you can actually detect it in the blood. There are HPV tests in the blood, and other tissues. So you can also detect it in men as well. So it's for both sexes for that as well.
Okay. The next question is, someone is asking why the process for pap smear is so painful, that it makes the test discouraging to take.
Yes, it can be quite uncomfortable for a lot of women, and some in severe cases where the woman cannot bear the pain. I mean, some gynecologists I know use some sort of anesthesia, either local or general anesthesia, just to put the woman's mind at ease and make it a bit more bearable, I would say. But it can be painful and it can be uncomfortable, which is why it doesn't take more than a few minutes, 5 to 10 minutes at the most. But it shouldn't even take up 10 minutes, in fact, 3 to 5 minutes. Once you get the speculum in and they are able to take your sample, it's over. But if the woman has a low threshold for pain, I mean, some sort of anesthetic can be given for the procedure to be completed.
Okay, thank you so much. The next question is, what causes fallopian tube blockage?
Okay, so a lot of things can cause fallopian tube blockage. Cancer is actually one of them. There are cysts, they what you call fallopian tube cysts, there are lumps, there are cancer. So a whole plethora of things can cause fallopian tube blockage. Cervical cancer can cause that as well. As I said, it can spread to other parts of the genital tract. If it spreads to the vagina, it can block the birth canal, which will of course cause pain during menstruation. It can cause pelvic pain if it goes to the ovary, if it goes to the fallopian tube. So the spread of these carcinomatous tissues can actually also cause fallopian tube blockage. So a whole lot of things can cause fallopian tube blockage. Is when you do things like a scan, an ultrasound scan, an MRI scan, give more detail on what exactly is causing it. And of course, a pelvic examination as well can give a bit more detail about that.
Okay, thank you so much. The next one is, I'm not sure if the question is asking if cervical cancer causes affects conception or if the HPV vaccine. I'm not quite sure. The question isn't very full, but the question just says, does it affect conception? So I'm guessing it
Yes.
refers to.
Yes, it can cause conception if it affects, especially if it affects the ovary and the fallopian tubes. Of course, we know that for conception to happen, eggs from the ovary need to meet with the spermatozoa of the man, and of course, that's the passage through which they meet is also through the fallopian tube. So, if there is cancer that has affected the fallopian tubes or affected the ovaries, it may become very difficult to actually conceive because the ovary that is affected may not be able to release eggs, or the egg that is released from the ovary may not actually be able to pass the fallopian tube to be able to meet with the spermatozoa of the man, which is what is going to cause an embryo to be formed. So yes, it can, depending on the stage of the cancer and the organs it's affected.
Okay, thank you. The next question is, what is the difference between cervical cancer and ovarian cancer?
Okay, so just as the name suggests, cervical cancer starts in the cervix. Abnormal cells in the cervix can lead to cervical cancer. Ovarian cancer is closely related, but at the same time, it's a different thing. It starts in the ovary, although they have very similar symptoms. You know, most of the cancers around that region have very very similar symptoms. Even with ovarian cancer, you can have things like painful bleeding as well, bleeding in between periods, fatigue and all that. So the symptoms are quite similar. The difference is just where the cancer is originating from. So that's just the difference between the two, but they are similar but different at the same time.
Okay, thank you. Um, Someone is asking if there has been a confirmed link between PCOS and cervical cancer.
No, not really. I wouldn't say there has been a confirmed link between those two. I mean, they can actually coexist. We've seen women who have cervical cancer who also have PCOS, and also women having PCOS who have cervical cancer, but there is no research or study that has been done to link the two together. But sometimes they coexist in some women, but most women have one or the other, not both. It's just in a few women you would actually see them having the two because they are two totally different things.
Okay. I think someone is asking, okay, that they have someone who's in their 70s and her urine has a foul smell. And she's been to different hospitals and done several tests, but the odor still persists. Do you recommend taking her for a cervical screening test?
Yeah, absolutely, absolutely. I mean, as I said, it's important to be able to rule out different things, especially in terms of female genital health. There are a lot of things that can cause bleeding. There are a lot of things that can cause discharge. You have endometritis, endometriosis, you have cancers, you have lumps. So it's important to be able to do as many tests as possible. She's done some tests and they still haven't been able to have a valid diagnosis. I don't know if she has seen a gynecologist as regards this, or if it's just a regular doctor. So it's important that you see one, a gynecologist, a licensed and registered gynecologist, and be able to discuss the symptoms you're having at every point in time, and of course, to be able to do the necessary tests, if possible, a pap smear, just to be able to know if there are any abnormalities within the cervix. So yes, I would suggest that you see a gynecologist, and you can, of course, talk to your gynecologist. You can suggest the tests what you are worried about, and in conjunction with your doctor, you're able to come up with a decision and a diagnosis that works for both of you.
Okay, thank you. Someone is asking if the use of tampons can lead to cervical cancer.
No, the use of tampons do not lead to cervical. Cervical cancer is not brought about by that. Now, if you talk about, as I've talked about female genital health, but it's important. Hygiene is very, very important, especially in terms of using tampons, to inserting things into the vaginal canal. It's very important that we're keeping the health clean, especially when it comes to certain things. So there is no correlation between tampons and cervical cancer at all.
Okay. Someone is also asking if if someone has fibroid, that they have similar symptoms to cervical cancer. So they're asking if fibroid has anything to do with cervical cancer.
Yeah, again, there are two different things. Cervical cancer does not have anything to do with fibroids, just like I said for PCOS, they can coexist. Fibroids and cervical cancer can coexist. When you talk about fibroids, it's usually within the uterus. And usually within the uterus, it's swellings within the uterus. It has nothing to do with cervical cancer. The causes and all that is not related to that of cervical cancer. Or yes, they may have similar symptoms. Anything that involves the uterus, stroke the cervix, you know, we have similar symptoms: discharge, foul smelling discharge, bleeding, because the fibroid is pressing on the endometrium in the uterus, especially when you're having cycles, and then the shedding of the endometrial tissue, blood and everything. So it's similar symptoms, but it's two totally different diseases.
Okay. I think the last question is, do all Bastion health plans cover HPV tests and pap smears?
So there are limits on certain plans. So to an extent, most of the middle to high end plants have access to HPV and Pap smear. That's the information I can give at this point. I won't say all the plants, but to an extent, we have plans for genital health on all the plants. But depending on the limits and the kind of tests you can do, differ a little bit from plant to plant. But definitely, to see a gynecologist and do a pap smear, yes, yes, I would say it's covered for the plants.
Okay. Oh, sorry, there's one last question. Is there a way to prevent PCOS before it starts to affect women?
Yes. So first of all, it's important to know your symptoms, which of course mostly low abdominal pain, pelvic pain, bleeding, discharge. And once you start having those symptoms, it's important to see a doctor and do a scan. So in terms of prevention, early diagnosis or early knowing your symptoms early and being able to go to the doctor on time so that a scan can be done to be able to find out the best possible treatment for you. That is what is recommended in terms of PCOS. So that's what I would say. Knowing the symptoms early and seeing a doctor on time will go a long way to prevent that.
Okay, I'm so sorry. We just got one last question now. I think you've kind of touched on it, but just in case for the person.
All right. Hello? I can't hear you. I can't hear you anymore. If you're speaking, I can't hear you. Hello? Can other people hear her? Because I can't hear her.
Hi, sorry, I got
All right.
disconnected for this while.
All right.
Yes, sorry, I was asking, someone asked, I said you might have touched on it earlier, but someone asked if cervical cancer has a correlation with smelly urine.
Yeah, so it can be a symptom of cervical cancer. It can be when you talk about foul smelling discharge. It's not as common as you having foul smelling discharge anyway, but it can also occur on rare occasions, foul smelling urine as well. But the more common symptom is foul smelling vaginal discharge rather than urine.
Okay. Um, Again, the last question. I know I've said this a couple of times. The last question. The person is asking if there are specific hospitals where this screening can be done.
Yes, we have recommended hospitals within our network where these screenings can be done. These are usually hospitals that have their core in gynecology. We have very, very excellent specialists within our network, excellent gynecologists where this test can happen. So a good number of our hospitals have good gynecologists that can do this test for you and take care of your health, both in Lagos, Abuja, Port Harcourt, and other states of the federation. So yes, just we're able to take care of you anywhere.
Okay, thank you so much. So I think the rest are more like thank you notes. So people are saying thank you and that they would appreciate a lot more of these sessions, especially on reproductive health. So they are giving their thanks. So thank you so much for
You're
your time,
welcome.
Akinkunmi. And thank you everyone for joining. We hope to see you in our next webinar, which will be happening next month and will be shared via email. Thank you so much for everyone that joined. If you still have questions, please don't fail to reach us on social media, or you can use any of our customer care lines.